Did you know that immunization is one of the most efficient ways to protect your baby against severe infections like bronchiolitis, pneumonia, which could be caused by a virus called RSV in newborns? Today, I'm going to talk to you about different ways that you can protect your baby in the first couple of days of their life and even before they're born. Hi, my name is Jessica Gorgi. I'm a pharmacoepidemiologist and a researcher here at the Centre de Recherche du CHU Sainte-Justine. If you're pregnant, it is completely normal to have questions and concerns when it comes to your baby's health. And since information is key, what I want to do today is provide as much evidence-based knowledge to you so that you can make informed decision that works for you and for your baby's health. RSV is a common respiratory virus that can lead to serious complications, like I mentioned earlier, that can cause bronchiolitis or pneumonia, which are severe forms of infection in the baby and are particularly dangerous in the newborn stage. In fact, each year, hundreds of babies are hospitalized for these severe complications, but the good news is that there are ways that we can prevent this. In fact, there are two ways that I'm going to be talking to you about today. The first recommended option is a medication that contains monoclonal antibodies against RSV. It is called Beyfortus or Nirsevimab. These are the two names you'd have to remember when speaking to a physician. The idea is that it can block the infection towards RSV and therefore reduce hospitalizations for any of these complications that we know. Typically, these medications are given early on, so when the baby is born. But if your baby hasn't gotten this medication, and if they're about 6 months during the fall or winter seasons, it is ideal that you speak to a physician because they can still get it at that stage. The second option is actually a vaccine that mom can get while she's pregnant between the 32nd and 36th week of pregnancy, and it's called Abrysvo. The idea is that mom will create antibodies. They will cross the placental barrier and go on to the baby, and it will protect them and create some sort of a protective shield against RSV to protect the baby. The idea is that they will have antibodies from the beginning of their life and therefore be protected against not only the virus, but also the different complications that can come from it. Both options are known to be safe and effective. However, please note that their availability across Canada can vary. Therefore, my recommendation for you is to speak with your physician, with your healthcare provider, be it a pharmacist or a nurse practitioner, so that you can have a conversation with them and determine what's the best option for both you and for your baby. For more information, more resources, you can always visit our website. It's called healthypregnancyhub.ca, and you can also follow us on our social media because we post content like this quite often. I want you to know that you're not alone in your decision making. It is completely normal to have these concerns and questions. What is the most important and what we want to help you achieve is to have all of the information that is evidence-based so that you can make the best decision for both your health and your baby's health.